All right, check, radio check. Want to welcome everybody to our weekly chat with Chris. Being an ex-Navy vet, punctuality is very important, so I like to start on time. But sometimes we'll get some latecomers, but I don't like to penalize the people that show up. This week, I'm really excited to share the stage with Caitlin Erchick. She's my right-hand lady when it comes to usually all things health insurance and now Medicare and supplementals, things of that nature. She really is a great resource. Collectively, between our office, Keith, Caitlin, myself, Alan, if we don't know the answer, we can get to the answer. And what's interesting is that, this area, as we start to age into retirement, as we start to approach, there's a lot of information out there, and it can be overwhelming. I mean, it's voluminous, right? It's just, between the TV commercials, but that old adage, if it sounds too good to be true, you should probably pay attention to, the fine print. So what we're going to do here today, we're going to go ahead. I'm going to move on to the slides. I'm going to introduce Caitlin and allow her to take us through. And I may chime in a couple spots on some areas that I think to highlight. So Caitlin, thank you very much for joining us today, and welcome. And let's have at it.
Hi, everyone. So today we're going to talk about Medicare's annual election period. Also known as Medicare's open enrollment. A lot of the carriers call it that. Medicare sometimes calls it open enrollment. It runs from October 15th through December 7th each year. And it's a period when some enrollees can change their coverage effective the first of the next year. So January 1st, 2024, if you make any changes during this period, they'll take effect January 1st. Next. Who should review coverage? So if you have original Medicare, which is parts A and B, you can review your coverage. Then you can decide that you want to add Medicare Advantage at that time, or maybe you just want to add drug coverage, Part D coverage. If you are enrolled in a Medicare Advantage plan, Part C, you can go back to original Medicare, or you can change your insurance carrier and enroll in a different Medicare Advantage plan. If you have original Medicare with Part D, or maybe you have original Medicare with a supplemental plan and you have Part D, you can review your Part D plan at that time and change the carrier as well. Next.
All right.
Everybody who has a Part D plan or a Medicare Advantage plan should have gotten something in the mail by the end of September called the Annual Notice of Change. It's a really important document because it's going to compare, your plan in 2023 to your proposed plan in 2024. So you can see very clearly on that document which changes are happening in your plan. And it kind of gives you an idea of, should you be making a change or not. Next. So why bother reviewing? You can review the plan's new premium. So every year the premiums change. For Medicare Advantage, not so much. If you're in a $0 premium plan, kind of usually stays the same. But maybe there's new plans on the market that weren't there before. Like in Pennsylvania this year, I saw one of the popular carriers has a $0 HMO plan. Now they've added a $0 PPO plan. So always want to check that. Same with the drug plans. Those premiums change every year.
So Caitlin, let me interrupt there, because this is always sort of a burr in my saddle, because I understand marketing, I understand insurance companies, and I understand the government. And this is what I was alluding to. If something sounds too good to be true, what's the gotcha there? When they say $0 premium, I mean, does that mean that the insurance is free, or where is the be careful?
Well, listen, I mean, some of these $0 plans, I never recommend an HMO because you can get a good $0 PPO plan where you can go in and out of network with Medicare Advantage. But you pay as you go. So with any insurance, it's like pay now or pay later, right? So with Medicare Advantage, If you have a 5-day hospital stay, it could be $400 a day, which would, if you were in a supplemental plan, that's your entire year's premium. So that's the drawback. So if you say I'm healthy, I'm staying that way, or maybe it's not in the budget to get a supplemental plan, there's really great PPO plans that are Medicare Advantage plans out there, but you're going to pay as you go.
Okay, thank you.
So another reason for reviewing would be to check if your doctors are still covered. The networks can change from year to year, so it's important to just plug them in, check that they're still in the network. Maybe you added some new doctors over the year, and you want to see if they're covered. You want to make sure your prescriptions, new or old, are on the plan's formulary, because the formulary changes. And even if it was covered this year, it might not be covered next year, or you might get lucky and it's covered at a better price next year, which I just saw today with a client. You can consider how the plan's deductible and other out-of-pocket costs factor into total costs. And also, some coverage options offer extra benefits like vision, hearing, dental coverage that could help meet your needs in 2024. So it's good to see what's out there during this time, because you can't change any other time during the year. All right, next. So how to review. If you want to do it yourself, I always recommend going to Medicare.gov. That's the best place to start. You're going to review your prescription drugs on there. If you've got Part D, if you have Medicare Advantage, you can review it on there as well. If you make any changes, your new coverage will start January 1st, like I said. And if you're happy with your current Medicare coverage and it's still being offered next year, you don't have to do anything. It just renews as it is. Next. So some hot tips. Use Medicare.gov to plug in your prescriptions and check your Part C or D. You can check your pharmacy on there as well. That's really important, because if your pharmacy is not preferred, you're going to pay more for your prescriptions. The most cost-effective plans will be listed in order. That's one of my favorite features of the Medicare.gov site, because, hey, we don't want to pay more, so it organizes them for you. And then once you narrow down your plan options, you compare your current plan to the alternate option by viewing the summary benefits from the carrier website. So instead of just looking at the quick summary on Medicare.gov, there's a link to the plan website. You click on that, and then you'll put in your zip code. Sometimes you select your county, and you'll be able to see all of the details. It's just more detailed than Medicare.gov. Medicare.gov is a great starting point, but I always recommend going to the carrier website as well. And then I've seen this a few times. Some people move either, zip codes, or sometimes I have them move out of state and not notify anyone. So it's really important, because Part C and Part D coverage are based on your zip code. So if you move, your coverage might not work. So it's really important to update your carrier at that time as well. Next. Some important info for 2024. Medicare's Part B premium is increasing this year. It's going to $174.70. Not too bad, but about $10 there. And then Part B deductible in 2024 is increasing to $240. Also, Social Security announced the COLA adjustment for 2024, which is the cost of living adjustment, which is much lower than last year. It's at 3.2% this year.
Yeah, one of the things I point out here is that, for the first time I've seen it. So, I was building out somebody's retirement analyzer, and we were plugging in their premiums. And actually the year before, premiums were like 172, 173, and dropped, maybe even 174, and dropped to 169.40. So they're 169.40 right now. And then I was building out for next year, and somebody said, no, I'm paying 174. And I had forgotten that, oh yeah, they're having an increase. So, it is, especially when you're a retiree and entering into, your golden years, we are watching, every penny, every nickel, every dollar. And so, there are elements of our expenses that come through the Medicare, and Part B has that cost. And you have to be cognizant. And we're not getting into something called IRMA, or if you're doing Roth conversions, means testing, that can adjust your premium as well. So there's a lot of intricacies here that are probably too deep for us to get into on this call. But if you start hearing information, or if you start trying to do things yourself, and maybe you decide, hey, I heard, I want to convert and start doing Roth conversions, they're going to start looking back at 2 years tax returns, and then that premium is increased based on your bandwidth. So again, it's a little too deep for this call, but I just remember this is a moving target, and sometimes Social Security we get zero. Right, I've seen a couple of years in the last decade where we got no cost of living adjustments, and then we have been blessed with a couple, 8% and then 5%, retroactively in the last couple of years. So they're trying to keep up with inflation, but these numbers for retirees are really important. So thanks for pointing that out, Kate.
Absolutely. So what about other plans? So we just talked about Medicare Advantage, but when can you change things like your supplemental plan, your dental, your vision? So it really depends. I mean, when it comes to supplemental, you can change that any day of the year. But if you're outside your guaranteed acceptance period, which is when you initially enroll in Part B, you are subject to medical underwriting. And it could be just, 10 questions. But they will rate you based on the way that you answer those questions, and sometimes they can decline you. Dental and vision, it depends on the carrier, but if you're adding a new dental or vision plan, you can do that anytime during the year as well.
Yeah, and the one other caveat, and this is strictly Chris Lester's opinion, but I might have been born at night, but I wasn't born last night. And I think this whole Medicare arena is laden with, what's the best word to use? Just, we'll call it Christmas items. Because to me, being a business owner, I know that things cost money. I don't care if it's, I've advertised on the TV. I know how expensive advertising on TV is. I've also advertised on the radio, so I know how expensive that is. I see some of these plans that are offering zero cost premiums. Oh, dental's included, vision's included. Isn't that great? And then these carriers, right, that offer these, I have to sit back and scratch my head and go, you have an insurance company that is working with the federal government to push these plans. And it's about, Kate, correct me if I'm wrong, but it's about a 50-50 split, whether it be Medicare Advantage or whether it be supplemental. I just have learned in my career, and this is over 30 years, there are no deals in the insurance industry. So everything at the end of the day, there's some small print that you should be aware of, because if it comes time for utilization, you could be, get a very good deal right now, but as Kate alluded to earlier, it's pay me now or pay me later. And a lot of you on the call maybe remember that old cartoon Popeye, and Wimpy would say, I'll gladly pay you Tuesday for a hamburger today. And I always sort of think about that, because at the end of the day, when I see, this time of year, I've seen how much advertising is done on TV, and they're hiring celebrities. So it's not just anybody. So all of that extra fluff is there. And then, to market and print and do solicitations and mailers and packages, I see it and I'm like, oh my God, the waste that goes into, all the stuff that they print out, that they mail. So I'm scratching my head and going, all this marketing that they're doing, it's coming from the premiums that they're collecting. So although efficient, either the government's helping to subsidize it or the insurance company. So I would just say, hey, as much as you can do this yourself, you really should talk to somebody that sort of can guide you to make sure that what you're looking for doesn't sound too good to be true and can actually serve to meet your needs. So sorry for interjecting there.
Absolutely. And then this slide here, it's just if you or anyone you know makes less than $22,000 a year or $30,000 for a married couple, it's worth applying for extra help. A lot of people don't know this, so I like to put it out there. There's extra help that you can apply for via Social Security, but also New Jersey has a little looser standards for the extra help. So if you haven't looked at that and you're close to the income limits there, I would definitely consider looking at that because they can help with your Part D coverage premiums, deductibles, coinsurance, and other costs. Next. If you need help, you can contact me. There's my contact information. The big number at the bottom, 732-302-1810 is our main office line.
And so here's something I'm going to go ahead before we move on, because, you know, how do you take the information you heard here today? You go, well, I'm not there yet. I'm not of age. And when should you apply for Medicare? So it's AEP, right? So you're starting to age in, you're almost 65. You're going to be 65 next year, right? 65 is the target number that you want to start to look at plans. So how far in advance should somebody reach out to you, Caitlin, would you suggest?
You can apply for parts A and B 3 months prior. So I always say 3 months before you turn 65, give me a call.
So let's go through the mechanics of that, right? So you're still working, you're thinking about you got solicitations from the federal government, you're thinking about doing something, but you're still working, or your spouse is still working. And I know that a couple of our clients we've just had this conversation with, and it is confusing, and they're looking at, okay, well, my company or my spouse's company offers this, so should they apply for Part A and should they apply for Part B? What are the pros and cons if a spouse is working and they have credible coverage? What should they do there?
So you can always apply for Part A if you've worked 40 quarters, so 10 years. That's a $0 premium. So if you've done that, it can't hurt. Now, Part B, it really depends on the situation. So if you're working for a company with 20 or less employees, then you want to apply for Part B when you're turning 65. If you work for a larger company, then you can stay on the company plan that access credible coverage, and you're good there. And then you would just switch over when you're retiring or your spouse is retiring. So yeah, it's a case by case situation. And there's other things to consider, like, are you paying into an HSA? But yeah, I really like to look at it case by case.
Agreed. And the only other two caveats I would throw out there is that if you are still working and you decide to enroll in Part B, but you have decided not to collect Social Security, or let's say you just retired and you decided not to collect Social Security yet, you're gonna wait till full retirement age 67, or maybe you're waiting until age 70. That premium is due. So if you basically, they'll send you a bill and you have to pay that 164.90, or next year 174.90, right? So that is something to be aware of, because that could be an expense that we need to budget into the future. The other thing that I think is important is that sometimes we're dealing with federal employees, and I was just having this conversation with another federal employee advisor, and it's 50-50 on whether, because they have, FEBs, federal employee health benefits, which is the federal side, which is, really comprehensive, right? Should you spend the money to go ahead? You retired, separated from service, you have access to this comprehensive health plan. Should you spend the 164.90 or 174.90 times two, because it's typically your spouse, right? It can be in excess of $300 a month when you have a comprehensive plan like that. And I'm of the opinion that you don't need to do that, because you have this comprehensive governmental plan. So that's one of the few times that I may not recommend Part B. But remember that if you do not sign up for Part B, on time and you should have, or maybe you thought you had credible coverage and you can't prove it, there is a penalty. And that penalty will follow through and stay with you for the rest of your lives. And that applies for both on the health insurance side and on the Part D premium. We just got a question in the chat, so let me see what they said. So Harry, I remember that to apply for Medicare, first you have to establish a Social Security online account. And then when you apply for Medicare, the entire multi-step process took over a month. So he's saying that to me directly, and I think they have streamlined that, Harry.
Yeah, it can take that long. Most of the time I see 2-3 weeks. But yeah, it can take that long. It depends on what time of the year you apply. Did you upload all your documents at the time that you applied online? There's a lot of things involved. So
Well, good. So, and then the last thing I want to throw out there is, so I went down a rabbit hole, but really what I want to say is that, look, if maybe you're either in a situation where you don't need care, maybe you're like all set, I've already done it, did it myself. How can you, either A, keep us in mind in the future, right? So we did a whole bunch of marketing this year. We did classes at Mercer County Community College. We've done training videos on Medicare, pretty in depth, and putting those on YouTubes, and we will continue to do that into the future. But we all know people. We all have either parents or friends or family or somebody that's going through this. There are 30 days basically left, right? A little bit less than a month left in this annual election period. And this stuff is overwhelming. People get confused easily. There's a alphabet soup of redundancy, right? Plan A, plan B, part A, part B. You're like, oh my God, what is that? And it's easy to get confused. If you would like to, if you're at Thanksgiving, if you're speaking to your neighbor, if you have a coworker that's going through this or has questions, please share our information. Do not keep us a secret. We are here to help. I think if you're on this call, you've come to know us pretty well. We're not a strong-armed salesman, but they got to deal with somebody. So why not hitch your wagon to a company like ours, Professional Planning Services, because there is no added charge for utilizing our services. So, that would be my 2 cents, and that's our plug for us and especially for Caitlin, because she works so hard.
sure. And especially, I mean, even if it's out of state, somebody who has an out of state question, I'm happy to answer questions. I have a lot of resources across the country when it comes to Medicare, and we can get your questions answered.
Very good.
No problem.
And this is my favorite time of the year. If you like pie, specifically apple pie from Madalina's, our gift to you, our way of thinking from Professional Planning Services to you. Maybe you've gotten an email recently. Maybe you're online and never heard of us before, and you're on LinkedIn right now watching us for the first time. Doesn't matter to us. If you're willing to hop in the car and drive up to Madalina's on Route 31 in Ringo's, just send me an email, right? Send Caitlin, any of us, Keith, just say, hey, I want to pick up a pie. We've already got a list, probably about 10. And typically we give away 30 pies every year. We need to know in advance because Thanksgiving is like literally now 2 weeks away. Right. So we're going to be doing a couple more emails and then that final list. What's the date that they need to let us know? And what's our pickup date? Have we decided that?
Yes. So Janet likes them picked up before the week of Thanksgiving because their store gets really super busy Thanksgiving week. So the Friday before, I believe it's the 17th. Yes, it's the 17th.
Okay. So make arrangements to get up there to the 17th. I will also ask you, bring a little bit of cash because they got lumberjack chili there, or they got a shepherd's pie or chicken pot pie that they make some homemade stuff there that is absolutely. And don't forget the cheesecakes, right? I'm telling you, I've been working hard on my weight, but this is the time of year where I tend to, to go backwards. So please make sure that you make it a point to get your apple pie. And our way of saying thank you for all your support all year. Lastly, this is our disclosures. Caitlin, thank you very, very much. Great job. And if you need anything, reach out.